Alright guys, I'm going to go run through medieval prevention and treatment. A little bit of a long one this one, so bear with me, but it should be useful come the exam. Now, I've kept my glasses on this time, so as not to offend certain students from my class, so yeah, that's why the change is there. Okay. Um, First thing to know about preventing disease. Now, physicians, they're very expensive, so there are different ways people would um, pay or seek services of how to prevent or treat disease. So we're going to be looking at as we go along. But a physician is the medieval equivalent of a doctor. Very much prescribe things like a herbal remedy or going to the barber surgeon. Right. First thing to note down on how we can prevent disease during this period, the regimen sanitatis. Now, this is all about moderation, not overexerting yourself. A lot of it goes back to the ideas of previous kings, people like, Edward the First, etc., who don't not to eat more than you can. That's why you might get a disease or overindulge. It's just a set of rules on good health. Again, people like Hippocrates and Galen advised things like this. Um, so again, they were normally quite expensive for a physician to write up, and the rules would take into account the patient's lifestyle and humoral balance. Remember, a lot of this stuff is interlinked, so it goes hand in hand with the four humors. Okay, we've also got the links to God. So sin-free life is key. Pray to show your connection to God, to avoid any illness. Confess your sins is important, and paying your tithes, of course, because remember, who's all powerful and all dominant at this period is the church. So they would expect that donation, and with that donation, you would have support in spiritual support and prevention from disease. Okay, so people try and keep clean. Again, contrary to what people believe, it would be quite common to consistently clean yourselves. Get rid of these bad smells. So again, leads to miasma. Problems with the lack of bathing, the lack of baths, very much a Roman thing. However, they would quite often use rivers and lakes. And again, all part and the parcel of this, guys. Just keeping a clean lifestyle. Make sure you take note of it. It's important for it could come as an explain question. Explain how in medieval times how prevention of disease would occur, something like that. As long as you can delve into these points, you'll be absolutely fine. So four humours in eating, and again, similar to the regimen sanitatis, not to overeat or overindulge because this could imbalance the humours. Again, the rich were at risk of dying, like Edward I, as I said before, had died from dysentery, and it had been attributed to this overeating, overindulging, this diet of red wine and red meat. Okay, miasma, so purifying the air, that's very important. Also important when we come to the Black Death video. So ways you could do this: carrying flowers, pomanders. So pomander again, strong smelling herbs, or would normally be around the waist, could even be around the neck. Clean the streets is important. Removing dead animals. Okay, we've also got ways we can, well, when we look at this is more care and treatment, and not so much treatment, more kind of looking after, so more the care aspect, and this is hospitals. So medieval hospitals in particular, quite often just used to keep somebody comfortable. Remember, it's controlled by the church, so the workers there are priests and nuns, and you'd be fed, you'd be bathed, and you would be made comfortable, prayed over. Okay, so how could they help the sick? I'm going to go over this in a little bit of detail because I have seen it come up as a 16 market, and it can be a tricky one. So do make sure you get notes down on how hospitals help people. So hopefully most of you are aware by now, it's all about hospitality. Okay, like hostels where people could just stop and rest. They were big, they were small. They did have specialized hospitals. So a big one in this period is something like the one set up in Lanfranc, or sorry, the one set up by Lanfranc for leprosy. Okay, right. Again, how could they help the sick? By the church. Okay, provided by monks or nuns. Again, the church wouldn't pay for them. It would be backed by rich people. It was more normally part of charity. There was nearly 1,200 in England and Wales. And if you're looking for specialist hospital, St Mary of Bethlehem in London, which looked after poor or silly persons. This is where we get the name Bedlam from. But remember, physicians were not really part of this. Okay, this is a breakdown of who would be looked after. Again, just take a note of some of these. More so, you don't need to worry too much about the statistics. Just who was the common clientele. So the poor and elderly with no medical care is the dominant. Okay, so patients were, again, food. Like I've said before, it's all about food, it's all about care, it's all about keeping people comfortable. You could get herbal remedies, but again, praying for the soul, and services would be throughout the day. So this religious overview throughout. You also had medical schools which were opened up, as well as hospitals run by monks and nuns. Again, a bit of a reminder of the statistics, but that recurring theme of looking after them, praying for them, giving them comfort. Again, so physicians, remember, all for the rich, very expensive. They were trained. We are going to look at that. They were trained in universities, but it was all only accessible by the rich. So there was a lot of rising in hospitals during this period. For that traveller, for those people's going on pilgrimage. Remember, a big part of our prevention is, go making a journey to Canterbury Cathedral, or if you're really sorry, going to Jerusalem. Again, it was good set to recover, it was free, it was charitable, clean, comfort, to be looked after. If a significant thing here, guys, is if you were ill, or sorry, contagious, so infectious terminal patients, you'd be sent away. Because at home, which we will look at in a moment, is the housewives, that or the woman of the house would be the one who was meant to keep you comfortable, keep you looked after. That's what was generally expected during this period. And again, you would get these passed down herbal remedies. Right. So, diagnosis. Diagnosis in this period, I think a lot of you will look at things like the star charts, the urine charts, and the Book of Galen, and that is essentially what they did. So their go-to would be the Vademecum, meaning the Go With Me book of diagnosis, and a urine chart. They would look at the smell, the taste, the texture, the colour of the patient's urine, and they would use that to base their assumption of what are you suffering from, how are your humours unbalanced. They did have a look at the pulse check to see how weak your blood flow were. You would also have posies, oranges, lighter tapers, because miasma, again, was one of the causes. It was always split up into supernatural and scientific, and quite often these would go hand in hand with each other. So, for example, if you mixed herbal remedies, which is the scientific method, you would also pray or say some holy words. This just shows how supernatural and the scientific. All right, guys, just going to look at the suggested treatments that you potentially have in this period. So again, make a list of these. These are going to be very useful. So fasting is one. Fasting is a good way to show how sorry you are to God. You would also have healing prayers, incantations, again very similar. It was looking for God for healing. You have bloodletting. Now, bloodletting, you likely the one you guys would all go to. You would cut your vein. You would use leeches, or you would use cupping, which is a heated cup over the skin. Now, this was to balance the humours, of course. You also would go on a pilgrimage, again, more spiritual and religious. This would, you would look to maybe heal yourself on a relic, or show your, or seek forgiveness from God. Purging, again, linked to our four humours. This was to balance it out. Similar to bloodletting, you would remove that excess humour. You would use an emetic, strong bitter herbs which you would throw up, or enemas or laxatives basically to poo. Herbal remedies, these will be your mix and concoction to take to treat you. Teliaka is one of the most popular ones in this period, made up of 70 spices. So if you're thinking of one herbal remedy, pick out Teliaka. Right, just looking at the healers, guys. So your first one really is the trained physician, the most expensive. They go to university, diagnose using a urine chart. They always have Galen's books. Remember, this is a dominant textbook, so physicians take everything from Galen. Star charts, again, only for the rich. They are also only men. They will normally prescribe herbal remedy or potentially a barber surgeon. Right, the apothecary, your go-to for these herbal remedies. They're trained, no qualifications though, mix ingredients. They can make money, especially if you go straight there. It's a bit cheaper than a physician, but they'll also make concoctions or herbal remedies for the physicians themselves. They're normally a man. Just keep in mind as well, guys, they do not follow the Hippocratic Oath. The physicians do. The Hippocratic Oath is important because this is the oath that you will do all you can to ensure you heal that person. This leads to myths with things like the apothecary, who have been known to maybe give you poison. Okay, barber surgeon, again, similar to apothecary, would be a physician may tell you to go to a barber surgeon, or you go straight there for your simple hack and slash, kind of pull the teeth out, take the limb off, or do bloodletting, for example. There's no anesthetics, very painful. A lot of people would die in surgery, so the risk was high. They're not really that well respected. The sign you can see on the screen there, that was the pole displayed outside. It would usually show the bloody leg wrapped in bandages. You've also got the housewife, the most common. They're free. They would pass down these remedies. They would deal with general kind of. They would deal with these general kind of issues. They would use herbal remedies, etc. Again, normally the lady of the manor, but it also could be the elder of the village. They wouldn't attend universities. Again, right. Finally, guys, we'll just look at how you'd be treated by God. We've covered it a little bit already, but this would be one of the general go-tos of how to treat yourself. Prayers, incantations, going to mass, fasting, pilgrimage. Again, quite often you'd be actually discouraged from seeking a cure, because is the idea that God had sent that disease and you need to let it run its course. So again, that encompasses it in the entirety of the medieval period. Right, so that brings it to an end. I tried to keep that relatively short. Covered quite a bit in there. I know it can get quite repetitive, but do ensure you're comfortable with every aspect of this, because if you understand it and you're comfortable with the preventions and treatments in this period, you can use it when you go through the other periods as a comparison. Because remember, the key aspect of this is continuation, or what's changing. Okay, similarities, differences, etc. between periods. So keep that in mind. Right, quick shout out to Ruben. And I'll see you all. See you guys next time. All right.